Hi, everyone. I hope you're well. The first topic I want to talk about is high blood pressure. So, in order to get a good idea of what information to cover, I asked a group of people what they currently know or think they know about high blood pressure. Here's what they said. Tell me what you know about high blood pressure.
The answer is nothing. I know that there's some people who theoretically, I assume, make my blood pressure high, but in terms of scientific facts, I actually don't really know anything.
Okay. Do you know what a normal range is or what a goal range would be?
I think it is 120 over, I don't know the bottom number, but I feel like 120 over, I don't know, 90 maybe.
Okay. Do you know how the size of the cuff can alter your blood pressure reading?
Oh, no,
Okay.
not at all.
Do you know what the different numbers of blood pressure are called and or what they represent?
I think one is systolic and the other one starts with a D.
Okay. Do you know what they are or what they're
Oh, like what
telling
they
you?
mean? I don't.
Okay.
Mm-mm.
Do you know what to do or what not to do when your blood pressure is being taken?
Oh, okay. Maybe not crossing your legs.
Okay.
I think like upright, just sitting, feet on the ground, upright, relaxed arms.
Okay. See, you know some things about some blood
I
pressure.
guess
Girl,
I
give yourself some credit.
do.
Do you know what the nickname for high blood pressure is? Its notorious
No.
nickname. Like if it were a gangster, what its name would be.
The beatus? I don't know.
Oh my gosh. Okay. All
I
right.
have no idea.
This is why I'm doing this. I love it so much. Okay. And is there anything that you don't know about blood pressure that you would like to know?
Probably a lot based on this conversation. I would say more than I know now.
Okay. Tell me what you know about high blood pressure.
It's basically just like the force at which the fluid is moving through your blood vessels. And if it's high, it can cause stress on the arteries.
What range do you think your blood pressure should be in?
Well, I know normal blood pressure was 120 over 80. I think in the last 5 years that changed somehow, but I don't know which way it went.
Do you know what the different numbers are or what they're called and what they represent?
I know it's systole over diastole. I'm going to say the top number, like the higher number, is like when you pump out. So I imagine like this, I think it's the systole is the highest one. It's like the number when it pushes out, like the highest force. And I feel diastole is probably like what like the minimum force in there is.
What are we concerned about when someone has high blood pressure?
Blood vessels bursting. And they could burst in a lot of places. And the scariest places are the brain and the aorta.
What are some serious
Oh,
conditions that can happen as a result of uncontrolled high blood pressure?
oh, heart attack, stroke, blood clots. Ooh, thrombosis. No, that's veins.
I love
Maybe,
it.
I don't know.
This is good. This is why I'm doing
I was
what I'm
kind of
doing.
listening for visual cues, but this is a test.
It's totally not a
Or,
test. I
sorry,
am,
hearing cues, not visual.
yeah. What can you do if you have high blood pressure?
I would be remiss if I didn't say first, consult your health professional.
The correct answer.
Lifestyle choices, it's basically like reducing stress in your life. I think sodium, like reducing your sodium helps.
Is there anything that you don't know about high blood pressure that you would like to know?
I never really thought about it because I'm like, This is a problem I don't have to worry about until I get to a certain age. But is there something I would like to know? I want to know if I got my answers right, especially the thing about cholesterol.
Stay tuned. Tell me what you know about high blood pressure.
I know that the way that you nourish yourself can affect your blood pressure. The way in which you move your body or don't can affect your blood pressure. If you are overweight, you have a higher risk. Oh, I know that there are certain ethnic groups that are at greater risk.
Okay.
Yeah, that's what I know.
Okay. What is considered a goal blood pressure?
Is it 120 over 80?
Is it?
I think it is. One of them's diastolic and one of them's systolic, something like that.
Okay. Do you know which one is which?
No. I know
That's
that the
okay.
higher number is on the top and the lower number is on the bottom.
Okay. Do you know what each of them means or why one is higher than the other?
No, I don't know.
Okay. What should you not do or what should you do while someone is checking your blood pressure?
I know that you can't have extremities crossed. I think your feet have to be like flat on the floor. When I have my blood pressure taken, I have to consciously focus on my breathing because I am one of those people who gets nervous in a doctor's office and my blood pressure will spike from being like in the space.
Okay. Do you know what that phenomena is called?
No, I do not.
Okay.
I didn't know it had a name.
It does have a name. Anything else? Anything that you should not do when someone's checking your blood pressure?
No, I guess I don't know.
Okay. If high blood pressure were to have a gangster name, what would it be?
Oh, yeah. No, I don't know high blood pressure's gangster name, but I'd like to. I'm going to need the answer key to this when we're done.
How can cuff size impact your blood pressure?
Okay, this one I know I have experienced where the cuff is too small and my blood pressure is read as extremely high, and we adjust to a better fitting cuff and the blood pressure seems to be fine. So I'm assuming that there is a cuff size that should be used for a particular sized arm, and if you use the wrong one, then you can get an inaccurate reading.
Do you know how to tell if the cuff is the right size for you?
I do not.
Okay. Do you know how positioning of your arm can impact the blood pressure reading?
I don't. Next time I would like a topic ahead of time I can study.
That's
if
exactly
people identify my voice, they're going to be like, she doesn't know anything.
No.
High blood pressure, the things that it can impact, just cardiovascular health and just the overall body. To manage it, sometimes people need to go on medication if they cannot get their blood pressure regulated normally without any assistance. And that's probably about it.
Okay.
I know, I know the basics.
Yes. So what are some common conditions that can result from uncontrolled high blood pressure?
You can have, kidney and liver issues. You can have some cardiovascular health issues.
Do you know what is considered a goal blood pressure?
Anything over 120 over 70-ish is like, it's bad. It's high.
Do you know what the two numbers are called?
Now, I will get them mixed up as what's on top and what's on the bottom, but systolic and dystolic.
Okay. Do you know what the nickname for high blood pressure is?
Oh, no. See, now, if you'd asked me about diabetes, I would have told you the sugars, but see...
It's okay.
When some people talk about, I got high pressures, but I don't know.
Part of what I want to do is I want to inform people so that they feel empowered when they are having interactions with their providers and they feel like they know what questions to ask or what to be looking out for, or that they can have a better understanding when they're having a conversation with them. So this is very helpful. Thank you.